for that reason, we are seeing the real enhancement and interest towards energy daily life. And today we're going to talk about health therapy. So we have two devices in the market: health therapy legacy, that is the old one we used to have previously, and the new one is called health therapy prime. I want to focus what is the different features with health therapy prime, yes, health therapy legacy. And I want also to remind you a little bit more about the features that health therapy in general is giving to us and to our patients. So why we can utilize this technology and what results we can expect to get from our patients in our region. First of all, I want you to see that it is FDA approved. And nowadays we have here that therapy for indications that is. Will you help me to say it? So, remind what therapy is treating with efficiently. Yes. Number one, negative potassium. And recently they received an approval in Europe to treat the body indication. We used to treat the body off-label, but nowadays we can treat the body, the abdomen, the front abdomen, as well as the arms, the skin laxity, using a therapy. So no longer we are in the field of off-label use of technology, even though we have a lot of effective and successful cases. Very often when you do the trainings, trainees are asking why are therapy so expensive? Why you need to use this device for $60,000? And actually the reason for that is the transducer as well. Because transducer utilizes two types of ultrasound energy itself. It's colorimetric ultrasound, which is giving us visualization. And the unique feature for visualization in health therapy is that you can see it in real time. There is no delay. So if you have the patient, and actually we are using it in clinical assessment flow, you can scan the face and you can see if the patient is seriously infected with fluids. For example, if you don't have any caries or any other signs of devices to diagnose the patient. This is due to colorimetric ultrasound. What is the depth of colorimetric ultrasound inside the skin? What is the depth? You can see once we're doing the mass. 8 millimeters. Down, you can see 8 millimeters. It depends. The hertz are mentioned in the transducer. So you can see the number, because number is yes. So hertz will depend on the delivering of the wave. So if you have a transducer that is 10, 1.5, you will have very frequent waves that are entering the skin. That's why it's going to target the superficial layer that is coming out. If we're talking about 4, the waves will be very, very slow. They're going inside the skin. That's why the ultrasound is penetrating deeper and delivering it in a depth of 4.5. What is the size of thermocoagulation point? Of the point that we are delivering the energy. Because it's also very important to understand it, because the transducer is delivering the energy, the point is only between those two lines. And what is the size of each point that we are delivering? It's 1 cubic millimeter. So if you measure it, so why it is important? Because this treatment is dose dependent. Meaning, the more thermocoagulating points you're delivering to the targeted area, the more stimulation you are getting. And it doesn't mean that you can spare. I will do 100 shots, but I will do 20 here, 20 here, 20 here. You won't get stimulation. That's why the system itself has already programmed quantity of lines that you need to deliver in order to get the good outcome. So don't, especially if you're starting to work with the technology, don't play with the parameters. Everything is already preset to get the result. And then you can make a customization, variations, whatever you want to do. Colorimetric ultrasound and microfocused ultrasound. What is microfocused ultrasound? It's delivering the energy, it goes and penetrates the skin, transparent, and depending on the depth, it's going to create a zone of thermocoagulation, a dot. And it delivers the energy like those charge of the transducer is way faster. So you can deliver the shots faster, so means your treatment will be 20% faster. Again, it is very good, especially in the busy practices. The depth of penetration, those are the three types of transducers we are utilizing. Do we always need three types of transducers for each patient or no? So that's why visualization is very important. We have three types of the transducers, and we need to see what we need to target. And what we actually need to target. We need to target SMAS. SMAS is a membrane, it's like a fibrotic network that's covering the muscle. So we're trying to contract this fibrotic network and gives the lifting for the area that we're treating. Imagine if the skin and the face is a bra, when we shrink the holders of the bra, it gives the lifting. The same happens with the face. When you contract the connective tissue of the skin on the top of this mask, you can give the lifting effect on the face. What about fat dissolving? It's usually you can see one of the concerns of the patient. They say, after yoga therapy, I saw that it can dissolve my fat. And that you see I'm already skinny. I don't want to use So therapy actually destroys the fat? No, it doesn't destroy the fat. Unless you're really trying to deliver as much energy as possible in the fat tissue and try to burn it, yes, but it needs to be intentional. So why we see the results of compactizing, like making the fat looks less prominent? Why? Because we're shrinking connective tissue between the fat folds. So instead of the fat that is hypertrophic, it starts to be more shrink. Imagine the sweater. You know, when the sweater is overstretched and you try to make it less big. What are you going to do? You put it at a hot temperature and the sweater shrinks. The same happens with the skin. We are delivering the energy to the skin, we're trying to contract. Good thing about that is that we are not delivering energy to the top of the skin, to the surface of the skin. So actually the energy will be precisely on the depth that we have been chosen based on the visualization. We have three main stages when we are talking about alternative technology. First, we are creating thermal damage. So we have physical stimulation. Thermocoagulation is denaturation of the protein inside the tissue. Do we always do denaturation, especially if we are talking about mature patients? Majority of cases, yes. And the reason for that is old skin preserves unfunctional collagen. So you need to destroy unfunctional collagen, activate and proliferate the fibroblasts to create the new collagen. Otherwise, you will have too high concentrations of the old, let me say, unactive collagen, the one that doesn't have the proper function for the skin. The temperature. This is also very important, and this might be the reason why some of the devices can have complications compared to off therapy. The temperature that has been measured in a therapy device range between 56 to 58 degrees Celsius. This is the temperature that creates denaturation, meaning destruction of hydrogen bonds in the collagen, so the collagen gets shrink. And this is why the patients see the result immediately after the procedure. When you do the treatment, if you did one side and you give the mirror to the patient, they need to see the difference. If they don't, means something was wrong. Either the transducers were not taken properly, either it's not enough energy has been delivered. So in fact, the patient is usually looking like this. One side is lifted, another one is up. And this is happening due to denaturation of protein in the tissue. Those are the stages that happens in the skin during the process when we are performing off therapy procedure. And look here, this is the word. We need to induce inflammation. What type of inflammations that usually dermatologists are creating? We can create chemical inflammation and we can create physical inflammation. So here we are building physical inflammation, but we need it. So if if your patient is taking any anti-inflammatory medication such as corticosteroids, methotrexate, often taken painkillers, this is what can reduce the result of the therapy. So usually when you start to give, when the patient say, I tried your therapy, it doesn't work. When you start to take medical history to understand where was the issue, whether the lines, the quantity of lines was not correct, whether it was not on therapy, but it was something mimicking on therapy, or the patient's medical history is showing that she was taking medication that is reducing inflammation. Other thing, there was a study in Italy. They tried to do therapy for the patients who are not taking protein vegetarians and the patients who are actually eating everything. So the patients who are not taking protein, 30% reduction on the efficacy of the procedure. So please ask. And it's not only related to therapy, it also will be related for any causal stimulation, erectile anything that we try to stimulate. Because if you explain to the patient, I expect the result will be less, she may think. But if after procedure she will call you in 3 months, she will doctor, you see, I don't see any difference. I pay money, 5,000, whatever, there's nothing. And you can start to say, oh, but it's because of this, this, and this. So it's excuse already. It's not, she was not informed. Okay? So try always to inform the patients prior to treatment. The more expensive the treatment, the more expectations patients have. Yeah? And another thing that our therapy was promoted previously as non-surgical facelift. No, it's not possible to do non-surgical facelift inside. The thickness of dermal layer. Again, there is plenty of studies related to how effective our therapy is. While you perform it, you can see that the thickness of the dermal layer in 2 months has been increased. And this is factual. This is really something that patients will experience. And I also recommend you to do pinch test for the skin before the treatment and after 3 months. It's going to be difficult to pinch the skin because of the quantity of collagen and elastin that has been produced in the skin. The patient will not be able to do the same. This is a beautiful study, I think, because it compares all the devices that are having similar technology in aesthetic medicine. So we have a microfocus ultrasound with visualization. This is all therapy. So you will see in the studies it's called MFU, it means all therapy. And the rest we have HIFU technology. So in UAE market, you know that the majority of the clinics they sell HIFU technology for all therapy. They say it's equal, it's the same. But actually it's not. So here they were demonstrating that several devices delivering the energy and spacing between the thermocoagulation points is not equal to the same as our therapy is having. Our therapy is having minimal spacing between thermocoagulation points. The size of each thermocoagulation point is uniform. You can see. And there are the devices, the other ones, the thermocoagulation points can actually move towards other layers of the skin, especially if the doctor is performing the treatment and moving the transducer while delivering the energy. And thermocoagulation points can be like a long drop, oval shape. So this oval shape will deliver the energy not only on the layer that you are actually targeting, but it can also create side effects that we are not looking for. Another thing that is important, if your clinic is busy and you're performing therapy procedures quite often, you can be sure that every time you are taking the new patient within the same day, your transducer is performing and having the same temperature as it was in the beginning of the working day. But nowadays, if you are taking the devices that are mimicking our therapy, if you have 3 or 5 or 7 treatments, the transducer gets temperature, gets very hot, and it can be dangerous for operator, that is a doctor, and it can be dangerous for the patient. Why? Because the high temperature can induce what? Post-inflammatory hyperpigmentation. Because if you're delivering the temperature towards the surface of the skin, of the dermis, especially 1 to 6, prototype 4, 5, and 6, we are in danger. And that's why some patients, they can develop the artificial line type of hyperpigmentation after performing certain types of ultrasound devices. So when we are talking about therapy prime, number one is the speed of the treatment. And there were studies that are showing that there is 20% increase in the speed when you are performing the treatment with the device. Another thing you notice if you often work without therapy is that patients sometimes get tired from the sound, this beeping sound, and here you can regulate all the uncomfortable environmental changes when the patient is 1 hour under the treatment. Everything can be adjusted by the script, and it's very easy to operate. Screen, visualization. And I want doctors who say that they are often using therapy legacy to try to visualize the new device, because the screen is 30% better. And also you will notice that there is no longer presenting the snowing, like the defects in the image, when sometimes it's very difficult to detect whether there is a little bit of fibrotic network or it's just defects in the image. So that's why it's really easy to detect the patient's products that were injecting recently. You can see the unorganic areas where the filler is placed. And another question, can we do our therapy if you see that on the area where you perform our therapy there is filler? So according to the studies, there will be nothing. So because ultrasound is penetrating through the gel. So that's why when you're using ultrasound acoustic gel on the top of the skin, nothing changes. Yeah, so the gel is not moving towards the water, it doesn't change the consistency. So there is a study that demonstrates ultrasound can go through the gel and it doesn't change the performance of the gel, it doesn't cause migration or dissolving. So everything, the other effects might be related to the temperature rather than actually the.
Did it go through radius also? Because there is calcium.
That's a good question. There are no studies only with the hyaluronic acid. However, we can just think logically. If radius is injected in the skin, it will definitely change acoustic properties of the tissue, right? Because of the area that is going to be creating the shield where because in our area so with the device we can see, so it's visualization, we can plan the treatment and we can customize it. What I mean by customization is that with transducer, because of visualization, you can check where the mass layer is. And it's not only about BMI, the body weight, how you see, oh, the patient has a lot of fat tissue, so I will use 4.5. No, very often, if you compare those two patients, they have BMI almost the same. But visually, your face looks skinnier than the model below. But their mass level is on different areas, on different depth. And you can see even this patient, your face is different depending on the size. So again, we need visualization to plan the treatment and to customize it according to the patient's needs. Very often, we have patients with prominent asymmetries, where one side is more saggy or more laxity than the other. For that reason, we can deliver more shots or more lines on the area just to make it looking even. And again, it will allow you to customize the treatment. And the eyebrow position, the same thing. One eyebrow usually is lower than the other. With this device, you can try to minimize the difference. Visualization again, you can see this view. And you remember the parameters that you will see on the screen. So here you will see the indicator for the transducer that has been used. It gets activated. The quantity of shots in the transducer. This is the two transducer. This is how many lines remain. When you are performing the treatment, zeros start to change depending on how many shots you are delivering. And the issue, usually the main issue with our therapy is I don't want to perform the treatment, I don't want to have it because it's painful. My sister, my neighbor told me to do it. So here we have a study that is demonstrating how therapy prime has less painful sensation on the patient. If we are talking about anesthesia, I still recommend you to anesthetize your patients, but not topically. So we usually do premedication. And this is the article that was done by Dr. Sabina Fabi, where she recommends to do the following
Ibuprofen juice like
it's constant taking of ibuprofen, not single dose because those patients who are having arthritis or some kind of allergy. So this the recommendations that the doctors are doing and they recommend to reduce any unpleasant sensation during the procedure. And it's not only related to medication, it's also related to environmental changes. Try to make the procedure in the areas where you don't have to often flow of the patient, the nurses are not around frequently. To make it very calm and relaxed, you can reduce the light, make it like a little bit dim while put the music, reduce the noise of the device. So all of this will really dramatically improve the experience of the patient. Therapy prime has been demonstrating the same efficacy compared to the device that we were having previously, to the legacy one. And it is still the gold standard for the lifting of the skin. And again, we are talking about eyebrow lifting, working with segmental zone and improving skin laxity in the neck, decolletage area. And recently we received the approval for treatment of the body indication. This is one of the examples. The patient didn't want to go through injectables because she is working in fashion and she didn't want to have any noticeable changes in the face. We were working mainly on the superficial fat pads because these are the areas that actually bothers her a lot, and this is the result she got after 4 months. I don't recommend also to take the photos of the patient earlier than this period of time, 3-4 months. After 1 month, usually there will be no visible changes in the face. Another example, the patient was complaining about the volume that was mainly focused on the buccal fat and the superficial and lateral fat pads. So this is the patient, this is a typical, as we call it, heavy face, typical for Arabic origin and Slavic as well. So those the patients you are performing higher quantity of lines in order to deliver sufficient quantity of thermocoagulation points to induce the production of collagen. Mini protocols doesn't mean that if you have a therapy and you don't have patients for big protocols and don't go use the device, you can create mini protocols, and one of the most effective one will be for eyebrow lifting. Here, very important to notice, because we are delivering the energy, it is important and crucial to understand the anatomy. And you remember that we are working with transducers that can go to the depth of 3.5 and 4.5. And if you forget that we are having branches of the nerves on the face and we're delivering the energy quite deep, it's going to cause issues and side effects which you don't want to have performing any treatment. So actually we are targeting the same SMAS layer on the forehead and temple region, and here I'm demonstrating, reminding you how it presents. This is where we are creating the regulation point and contraction. The trick here will be not to take the patients for eyebrow lifting who has prominent skin laxity. And we are talking about patients who has surgical indications, when you can see that there is a prominent and severe ptosis of the eyebrows and excessive skin on the upper eyelid. So those are the patients who will have minimum to zero results if you are delivering even the high quantity of lines. So for that patients, usually you do the test, you're putting the fingers and you're trying to lift the eyebrows. If there is a traction and it happens the lifting, you will have the result in your therapy. Some of the patients have so intense and so stiff connective tissue that you will not be able patients, usually you will have minimum results using the device. Here I want to demonstrate you the procedure. So you can see that it's very easy to perform, even though I'm using the wide transducer. But this protocol will require you maximum continuous. So it's very easy to perform. It's fast, higher patient satisfaction rate, relatively painful, especially if you see SMAS layer and you are not shooting and delivering thermocoagulation fluid towards periosteum, the patient is comfortable. And here the patient wanted to change the shape of your eyebrows, and we combine our therapy together with xeomin in the same session. So you can see from the spiky eyebrows, we will create more archy one, so it softens the features of the face. This is a typical situation with local patients. This is a American patient, so that's why I couldn't see the full photo. But you can see there is negative factor of the tail of the eyebrow for the patient, and you could reach the horizontal level. Usually at this point, doctors are asking how long the result will last. The lifting of the eyebrows. And usually it's not long lasting. We recommend to repeat after 4 months or 5 months, depending on the clinical situation of the patient. But usually in the beginning, you're informing the patient that it's going to be repeating sessions. It's not going to be one session per year.
How many lines are you doing?
So this is for this precise intervention, this is going to be the lines. What I also suggest is do have lines laterally and see. If you don't see any raise in the eyebrow, don't deliver neuron. So in this case, check, did you choose the transducer correctly? Maybe SMAS is deeper, is more superficial, number one. Second, maybe this is the connective tissue is so thick that it's not going to be any raise in the eyebrow. So usually the lifting is visible within 5 to 10 lines. All the protocols here are standardized, so again you can switch, you will do it in the model, you will switch the device and you will see the control lines that will be implemented by the company. Another indication that we discussed today, and this is now approved in Europe, we can use it for the body. One of the beautiful indications is laxity in the arms and frontal wall of the abdomen. So you are delivering here the combination of all therapy and kappa or radius. In this case, what will be the sequence of the treatments? Yeah. So always first we're doing the deeper treatment and then we're performing more superficial one. The result? And synergy. So usually when you have the patients, you can combine our therapy with any other chemical stimulation that you are having in the clinic. That can be skin boosters, that can be collagen stimulators. You can perform it in the same session or you can spare it in time. So this is the patient that was receiving on therapy treatment for improving skin quality. So mainly the focus was prostatic scars on the face. She wanted to prepare the face for the wedding. Our therapy was performed on both sides of the face in cross-hatched pattern, so meaning with horizontal and vertical lines. And immediately after the procedure, she was injected with radius and bilateral white for the skin quality. And not only we see the improvement in the scar tissue, but also you can see overall we changed the texture of the skin, we added a little bit more glowing, and there is some lifting also happened there. So beautiful result for the patient who only wanted to improve the quality of the skin.
You choose Ultera because of less than height?
Yeah, because we had only 1 month. For the wedding, there was always patients who trying to challenge us. I want everything without borders.
May I ask you about previous first on the arm? There is 20 line per bead, right?
Yes,
Yeah, and what's the size of the bead?
it's the size that is corresponding to the transducer.
And for the arms, first we do 2.5 and then 3.
No, usually the deeper transducer is the first, then you finalize with the superficial.
4.5.
Yeah. Yeah.
And we repeat the session after 4 months.
If there's application, yes.
And
Because you can see that depends on the severity of the laxity. Yeah, so it always depends on what case you're having. So if we take the arms of 5 of us here and compare how many lines we need to deliver, 5 of us will have different quality of lines depending on the quality of the state. And also keep in mind the age of the patient as well and the presence or absence of miracles. This will affect the efficacy of the treatment.
So we're showing 20. So 20 is 4.5 and then again
Yeah,
20.
yeah. Always
three.
you are doing minimum 2 transducers. Ideally, yeah, even for the face, it is recommended to do, if you have previous muscles at 4.5, you do 4.5 to 0. If your patient is unlimited, golden platinum card, he say, no, we can do any quantity lines, he can do 1.5 on the top of that. Why? The more connective tissue you are targeting, the more layers, the more cooling effect you will be getting. As simple as that. Some clinics I hear that they are doing only one transducer, for example, the cis muscle 4.5, and then they top up with the rest material instead of targeting other layers. Again, it's off-label. They're creating some other protocols. It's something that is not officially suggested by the company. The company is suggesting to do 2 layers always. So you can combine that with stimulation and the revive. I can this example. Another example. This is patient that was cleared with the oncologist of cancer. She's 44 years old, and we were treating her face after all the treatments she went through with breast cancer. But again, with those type of patients, we take the letter, the clearance letter, and we don't give any stimulation procedure. It's just safety. Those type of results. How often you will repeat the session for this patient? So the patient will say, okay, I did that therapy, when you should come back. I like the results, I want to repeat.
You can do like one for 6 months and then 1 year.
Yeah, so you can repeat the session after 6 months, some quantity of lines, but usually it's not the same protocol, not the same quantity of lines. Another thing that in Australia they were doing a study and they showed that if the patient cannot afford to do 2 layers, 2 different transducers, you do 1 transducer, you invite the patient after 3 months, you repeat second time. So you can divide even the protocol for the same patient.
And it gives us same
As per them, yes.
Yeah.
Yes. As per them, it's the same result because they did split face. But as we are having studies on therapy combination with radius, what is better to do? Radius and then off therapy, or off therapy and then radius?
Radius, because it's like stimulating the collagen, and then the therapy will have
Yeah, so this is recommended to do first off therapy and then radius. This is the recommendation. And it is even recommended to do it in the same session. So in this case, yeah, in this case you have 20% improvement in the collagen in the last introduction. And this is the difference between other energy-based devices. Our therapy has been so well researched, and tell me what other treatments that we know that it's really is indicated for collagen and the last introduction. We say, okay, red microneedle stimulates collagen. Does it stimulate elastin? No, from EBDs, from energy-based devices. Yeah, so we see there is improvement in texture, there is improvement in something, but this device really has studies that are showing you have collagen, you have elastin, meaning functionality of the skin. So you are not burning, you're not creating pathological collagen, you are regenerating the skin. This is why like in my opinion, this is one of the most is the safest method to use for regeneration from energy-based devices, because I know what I'm doing, I can see it. I know what I'm delivering. I can customize the treatment depending on everything that I have in the clinic, and I can combine it all together. Doesn't mean that if I use all therapy, I don't touch the patient for several months. No, the patient can also have skin boosters, other technologies, and it's very easy to operate with the device. So I see only pluses. And on the top of that, if you don't have ultrasound device in the clinic, you can use this device with a fantastic visualization. It's also the patients are appreciating during the consultation. When you consult the patient and you feel like, oh, I'm planning to do radius in the face, but I feel there is something, I always touch the skin before doing an injectable, but I feel there is something in the skin, and the patient say, no, like, for 5 years I have been known with injectable. You put the transducer and you check. And you see the boluses of the product. And if the patient cannot remind, you're not injecting. So it's your safety. And you can save the images in the new device also. So if something happens, you have also the proof. Or you record it from your phone. But it's something like the more indications and the more tools you're having for assessment, the better outcome you're going to have. So for me, it's really something that we are using very frequently. And mini protocols is also go-to in the clinic. You build mini protocol for eyebrow lifting. Patient every 3 months is coming to the clinic for this treatment. It can be both eyebrows. It can be one eyebrow, the one that is more depressed, more lower. So really, you can work with a lot of things.
I want to ask you this quickly, because you said that if there's a future hurt for front left of the back, the buckle of back and so on, would it give the same result as the Morpheus, what we were seeing, something kind of back or the
No, the one that I showed, the model,
Yeah.
the lady, we didn't do burning the fat in the buccal area. I was delivering more shots in the buccal area, and there is a study that is showing if you're increasing the quantity of shots just in the buccal area, you don't burn the fat, but you contract the connective tissue between the septi, and the fat appears less voluminous. So it's flattens.
it's like
Yeah, so there's no destruction of the fat whatsoever.
If you have patient with lipodystrophy already,
Yeah.
how do you treat them? Just to avoid this area?
Yeah. So the idea with patients with lipodystrophy, they have a lot of excessive skin. Yeah, the idea you want to shrink and to contract as much as possible this excessive skin. So you will be focusing on the area where you have the thickest mass, that is like masseteric area, to give this stiffening. And then you're working chemically for stimulation.
So it means like still, let's say thicker here and thicker above.
Yeah.
So you will go there, avoiding this area.
Yeah,
Still will
yeah,
avoid,
yeah,
right?
yeah. You try to avoid the areas where this lipoaction. And another thing that in Russia they are using protocols where they deliver huge quantity of light on the areas of the ligaments. So they almost not moving transducer when they are reaching the ligament, and they are delivering a lot of shots. There are no studies about what is happening with the ligament, but clinically they see very good shots.
A lot of shock absorption.
Like as per Professor Yana Yutkovskaya, they're delivering 250.
So don't be. Are there any local areas for the face?
Where you have the projection of the nerves, you're not doing yeah. So usually we are marking the noble area that will be here on projection in marionette line. This is the branch of the facial nerve. Yeah. Temples where I don't recommend you to do temples because we have the veins, and what I often see is the doctors are delivering thermocopulation point on the vein. It's super painful, and then the veins start to pop out because anything that is around the vein, if you inject something, it gets like a snake appearance. The same here. If you deliver the energy on the top of the vein, it starts to appear like a snake. It's like really visible, the patient in pain, and it's like a shooting pain. So it's going to be a lot of pain.
Regarding the transducer 1.5, how many shots do you prefer, or just like crisscross 2-3 passes?
I usually do
1.5.
according to the protocol that is
On
recommended
the market, there is no
1.5.
1.5.
Yeah, this is the
Because there is a market for 4.5 or 3, but for 1.5,
So usually, because if you're talking about my patient with acne, yeah, so acne scars can be 1 square centimeter or it can be 5 square centimeters. So usually you are marking the area and you divide it into the size of the transducer. It can be 2 stripes, it can be 3 stripes. And I try to deliver not less than 150 lines per area.
full area.
Yeah. So now they are having the protocols when they're using pulse therapy along with rheumatoid ref in the same patient, like small form or water mush together. But again, as per my knowledge, I don't know that there are publications about the safety. But clinically, what we experience is very promising results. But again, we're talking about Rolls-Royce study. Yeah, combine full protocol of therapy with monopolar ref. But the same mechanism. Yeah, you are delivering a lot of energy in the skin. So it's a lot of stimulation. You need to understand that it's besides the price that the patient is paying, what is the capacity of the skin to recover? Yeah, because a lot of energy they will be something that it might get bound in a good and in a bad way. But what I saw so far, like within maybe 12 or 15 patients, I experienced in combination with monopolar ref and our therapy, it's very beautiful. Really, I would not say like surgical type, but absolutely noticeable the difference in the lifting, in the reduction in the labor and minor declines. It's very good.
Do you have any combination of
So my opinion on that, I'm not a big fan of lipolytics in general. So now we are preserving the fat, we try to keep it as long as possible. It's our endocrine organ and our stem cells, just everything in the fat. So we are trying to preserve it as much as possible.
Many
How-
people have, heaviness. They want the
Yeah.
fat also to go.
However, when you are scanning the face and you can see that mass layer is way below 4.5 because of the fat, there is a reason why you can do that. But please always use the products that doesn't induce a lot of inflammation. Because sometimes I see after lipolytics on the screen after 1 month, you have a lot of fibrotic tissue. And this fibrosis will not allow ultrasound to penetrate properly as well. So it's partially will destroy the acoustic properties of the transducer. So again, if you're absolutely sure that you are using lipolytics that uniformly dissolving the fat, that they're not inducing fibrotic tissue there, makes a lot of sense because you're minimizing the fat tissue, your mass is lifting more up, and you're targeting the transducer. That's why visualization is very important because when you use transducer and you see where your mass is, by compression of the transducer, you can regulate the depth. So additionally, at least 1 or 2 millimeters, you can make it deeper or more superficial in between the transducers, between 4.5 and 3, because you are minimally compressed. So always play around with the compression as well. So you can really customize the treatment. That's why I need visualization. Another thing, my question. So sometimes I see in the clinics when we are doing the trainings, there are transducers that are having like scratches or indentation in the membrane. So does it affect anything in the performance of the procedure? Yeah, so definitely it will. It will, because the areas where there is defects, you cannot guarantee that it's going to create exactly thermoregulation point, or this point will be on the depth where you are looking for. So maybe the transducer is 4.5, but because of the defect, 1 or 3 thermoregulation points will be more superficial or somewhere scared, like spread in the tissue. So try to teach your nurses to be super gentle to the membrane of transducers. Another question about transducers that are expired. Should we use them? I mean, they're closed and I will just open them. And, I mean, it's not injectable. It's not contaminated. So logically, it's here. Transducers having water inside. So when transducers are expired, there is some kind of loss of water in the transducer. So the best case scenario is going to affect the visualization. The worst case scenario is going to affect, again, the penetration of ultrasound in the tissue. For that reason, if it's possible not to use them, don't use them. Because you will not be sure that you are in the exact depth that you want to deliver thermoregulation for.
Do you have protocol? I mean, I never have seen protocol, official protocol for body.
Yeah.
Yeah.
I can send you the front document if any of you is interested after. Can we just email? Yeah, so we can send. It's front abdomen and lungs.
And one more question. With transfer 1.5, do you treat darker skin tone? Okay. Because still they have this line.
They sign consent form, and
There is
if you see wells, or if you see some kind of swelling on the areas where you deliver the shot, you use support for any anti-inflammatory and sunscreen. So usually the wells are appearing if there is no proper coupling of image check. So now I attended two lectures, one by Tatiana Pavic and one by Gabriela Gasabola. Gabriela Gasabola is telling that when you're delivering the shots, you can move the transducer. So you're delivering and you're moving at the same time. So as per here, you are delivering thermocoagulation points exactly smoothly on the same level as it is. According to Dr. Tatiana Pavic, you should deliver the shots, stop, and then move the transducer. Because per her, when you deliver and you move, your thermocoagulation point instead of round start to be like a drop or changing the shape. So it's again can target not only the layer that you're actually focusing on addressing, it can also target the other layers.
So for darker skin tone, better to move 1.5. I'm talking about 1.5,
Yeah.
right?
Yeah.
I'm on the safe side.
I'm yeah. Because when you're delivering shot by shot, there's high probability that you will have the wells that will be creating very irregular shape, and the patient will be super unhappy and scared of inflammation. But you should not be afraid about the post-inflammatory complications. So now we can move towards the model. Yeah. Yeah. So if there is any chance you want to try, I really want you to experience the device itself. I want you to experience all the user journey. Like when you put the gloves and you try touch this the touch screen. Because now the device is so responsive, so it's not that you need to all the time press and you cannot and you can move the glass, no, nothing. It's really very fast responding to anything that you are trying to address. Try how fast the cartridge is recharging. So when you're delivering the shots, how fast it is, especially if you're working often, you can hear by the sound. Visualization is also very important, especially if you have old device. Compare how it looks with the new one. Maybe next session we need to do old legacy and the new one and do half of the face just to see the difference. Yeah.
Do you make any changes to your protocol when they are patients, and especially the 40-50 plus?
To be honest, it depends on the laxity. So the severity of the laxity, the main rule will be the more laxity, the more lines you need to do. Whether it's male or female. The beauty about the therapy, it's there is no difference between the gender, age groups, and ethnicity. It's going to be only skin laxity because this is the main indication. So if you have patient who is 40 male patient with a severe skin laxity, and someone is 60 like Ricky Martin with a zero laxity on the skin, you will not deliver equally. You won't get it
So
right.
yes, again, best to combine the individuals and
Yeah, we can do it together. Yeah, but
on the same session.
we can do it in the same session if they can. But with the radius, the same thing. You need to have to minimum to see. Yeah,
Domain now,
that's good.
generally how many lines are we giving right now?
It's more than 1,000. Yeah, so you imagine. It's very solid growth. When you see a patient who wants to do abdomen, well, more than happy because it's a big growth. And again, the areas in the abdomen can be only around the umbilicus, like only a small one, or can be big. Yeah, maybe the patient is only complaining a very small area has placenta. Certain quantity of lung. Maybe the patient wants from the pubic area towards her breast. This is absolutely different area. Some patients that don't like after C-section, there is a small area above the scar of C-section that is very cracked. So here it's going to be like around from 5 square centimeters, sometimes 10 square centimeters. So it's absolutely versatile.
And which ones was it?
face or one body together?
Face
So how many line you want the face normally?
So it's amplified protocol. It depends on the severity of plastic in the skin. So usually my protocol is around 600 to 1000, depending on the size of the face and depending on the laxity. The more laxity, the more quantity of lines you deliver. So your standard protocol is in the system already, but nobody kind of prevents you from increasing quantity of shots. If I want a little bit more lifting for the face and I deliver already standard protocol, I will focus a little bit more on the auricular area where this mass is thick, just to give a little bit more traction here. If I see that I did standard protocol, but I'm still not very happy with the dictation of the malar area, I will do additional shots in the malar zone. Beautiful area to treat without therapy. Precisely, like if you have patients who have malar edema, you do regular without therapy. The same thing. It shrinks connective tissue between the septi and the fat. It doesn't do anything to the fat. But the fat is start to be surrounded by more collagen. And instead of being very hypertrophic, it starts to be more like collective.
So how many shots will you have?
So here I'm doing around 30 shots. Cross catch.
I don't know whether whoever is sitting here has experience with Altera or not when you're talking, because I was the first buyer of the first Altera in all the area. I think that the doctor has to do herself from himself. Doing 1000 shots is really a big time consuming.
That's why it's the price of it.
Exactly.
You never do
From
it
the
like
other
5,000 milligrams.
From the other hand, price is high, and the other hand, the transducers are having. What I have been told that the new transducer will have more lines. Otherwise, with 2,400, how can your competitors are ultra fiber, ultra lift, ultra silk, you know? They are giving 12,000 lines in every transducer. And now we are giving them for 2,400. And in this competitive world, and we are doing it ourselves. So one of these ways we have to get ahead. Bigger transducer, bigger, and again, my own, if you know that how many I have done there, but it's not that much faster because all my Alteras, maybe 2,000 today I have done myself. It's not that much faster. So when we are talking to the conferences and with that much difficulties I will share to get your experience, reality is different what the company is giving us. Reality is different with the patient is getting the result. That's what I'm doing. Without increasing the shots, without doing that, it will not be that easy to convince the patients.
I don't know, I never experienced that difficulty, and again, with the speed, we're talking about 20%. The company is not saying it's 50% or like 100% is like delivering the shots. Another thing that you need to keep in mind that this is a platform now. So what we hear that it's gonna be more things to adjust on this platform. So something will be changed in the transducer very time soon. You can be more.
Yeah, maybe in 2027 we will launch a new transducer. Maybe also we will include a new indication for the body and for the arm, which is also going to be different. And we talk about the FTP and visualization. This is very important also for the patient can put the result.
My patients are very picky and they are always asking to show. So they're like lying down and they're checking where is this mass layer, you know? It's like I need to explain to them everything. So again, it depends on the profile. I know your profile of the patients, yeah? And they're coming there because you trust the technology and they will do it because you know what result you're going to expect to get. The quantity of shots is not depending on me. We can do something from another side, but the science behind the therapy, you know, you will not be using 2,000 treatments if you don't see the difference, right? There is probably
Wonderful. The reason as can we upgrade the machine at this in my case, because it is working. But you know, you are getting 2027. Many new machines will come together. The next one is the subway and Altera together. The same time is going up and down and 150. So you have to go towards the new technology because you are targeting the doctors. The machine is expensive. All of us, we need your help. You need our expertise. We need your help. 2027, that who knows what will happen. How
No,
many
if
new
we are
machines?
talking about the maximum of interested and that you know because any
I have heard
hospital-
million times of this.
Yeah.
Always me.
It's tough, doctor, because we were registered for the FDA. Sometimes it takes time to register even here in Europe, but we talk about the maximum of 20 days. Hopefully we can.
If I register what to 2027?
Because I'm talking about because I need to see myself because we are registered to FDA. Yeah, for that sometimes it takes time.
Do you think in front of the boy cards?
Yeah.
Then the FDA approved or not?
And it's very useful. Intimate area also include in that project. So again, you are building protocols. So in the clinic we are having mini protocols that is in our clinic is eyebrow lifting, the lips, and intimate areas in the clinic. So this is what helps you to generate regular customers because these treatments you're repeating after 3 months.
How is it working for this?
For the lips, you're doing 1.5 and you're doing from the red part of the lip towards the upper lip, towards the nose. So you're delivering minimum of 30 minutes. So what does it give to you? Collagen production, the pink color of the lips, and slight volume that, again, because of the energy, it's not going to last long. It's approximately 23 weeks. So we have beautiful patient. 41. As per her, almost virgin face. There is nothing. There is no fillers. 5 years ago.
2.5 years ago.
Oh, and a half.
2 years ago. Just
Yeah, yeah. But like as per her, there is no fillers in the face. Yeah. So let's discuss. Yeah. Just to see what we can see in the face of the patient. Yeah, so if you bend down the patient, you can see
Cameras.
Doctor, I can't bring the camera, it disappears, so we do that here or not?
I mean, I think it's better because people can see.
So it's here, we can
Yeah.
put here? Okay, so.
The same exact protocol as you start with normal on therapy medicine. So the patient presents signs of skin laxity. Usually you slightly bend down and I recommend you sometimes take the patients with the tilting the face downwards. You can see superficial nasolabial fat that is falling due to gravity downwards. And on the photos after the procedure, like after 3 months, you can see that there is a lifting and there's no so much fullness in nasolabial fluid and body metabolism. Okay? So usually what transducer we're taking for scanning the face? Why? Yeah, so now you're having platform, so everything is already on this platform, everything is easy to operate. So you have the shelf doesn't matter what is the depth of the transducer. 2,400. Zero, because we didn't deliver any energy so far. 60, and you can see those are the columns that we're supposed to treat if the mass is on 4.5. Energy is mentioned here. Again, you can play with the energy depending on what result you will get. So if you are delivering more energy, you get more contraction of the connective tissue. But in some zones, you need to be careful because higher energy can cause the nerve trauma. Half minute, 25 millimeters. 25 millimeters is the size of the transducer where the thermal calculation is done. Again, some situations can change the size to make it narrow. And it's going to correspond on the screen, it's going to narrow the line, this line here. This is the volume, so you can play this with the volume. Will be the same. We could just reduce the amount, yeah. That's like more points on the, yeah, it's less length of the points, but the point spacing will be exactly the same. Yeah. So you see, you can change the sound and make it almost nothing. So for the patient, it's not going to be very irritating to hear the sound of the procedure. We will see on the image, you can also actually measure the thickness of the tissue by putting the measurement. So it's going to be the line, the green line that will measure the thickness of the tissue. And you can save it and you can write the text. So for you to understand where is this mass, and you can save it on the computer. So later you can open the history and it's going to be there for you. Yeah. So now the memory on this device is higher than on the previous one. So as we go through, the best transducer to do visualization will be 3D. It has high capacity to see the tissue. Yeah. So now we have the gel. Before doing any scanning, we need to mark the patient, right? So please don't do procedure without any marking because it's very difficult to understand where you delivered, where you didn't deliver the thermocomposition form. So your treatment area, you always mark using the ruler. The ruler is coming inside